Robotic types of surgery are another interesting correlate because in essence what you do, there's two bunch of systems. One of them is a Da Vinci robot system. So again, using laparoscopic techniques through small holes, what you can do then is instead of you actually being at the table, what it does is allows you to make economy of motion based on a robot with you handling the controls, maybe even in a different room, but be able to do fine surgery with a steady hand. And you can operate in a really small space. So for instance, the robotic surgery became really well known is from the military. So if there was an injured patient out in the field, an injured soldier, he would go into this converted operating room. There'd be someone who put these small trocars are these little tubes in which we put our instruments in, and then somebody in another state, in another planet, could actually operate on them by putting their fingers into this instrumentation and by actually on a screen using 3D to operate and manipulate the hands of the robot, which may be miles away. And so that technology was brought back into the civilian service, so now we can do things from prostates to heart operations to any types of invasive procedure. But the key thing is that you don't have to be in the room. So if there's an expert, let's say, at prostatectomies, you can have that expert operate on your prostate and he'd be in another state. It's a huge way in which we can get expertise into the operating room, but as an adjunct, as someone not present, as someone in another place.
And this is only the start of a new type of technology.
Well, but you have to understand technology. Look what we did. We were looking at a phone the size of a thin piece of paper. Look how far we've gone from the huge computers. How big were your calculators when you started? So I'm just scratching the surface here for surgery. I can do so many things with advances in all of these types of machines and all these types of techniques. And then the best part is once I do that, all of a sudden I can create new operations. I can create operations maybe from the inside. So maybe I have a scope that goes inside and I have ability to use different ports and channels to operate from the inside. I might not even have to make an incision at all. So all I'm saying is that the way technology is working, we've gone from big incisions to small incisions to maybe no incisions because our technology has advanced us to cases where I may not even know how I could do a case. Let's say I want to take out a kidney. I may be able to actually in the future emulsify it. Emulsify means to grind it up in a way and make maybe 2 little incisions and emulsify a whole kidney and yet keep the principles of surgery, that's hemostasis and good borders and things like that. It's absolutely amazing what we can do, and there is no ceiling at all.